Hey, this is Phyllis. This is another update to my cubital tunnel syndrome surgery update. Today is July 31st, 2009, and I had to have another surgery today. If you wonder why I got my arms stacked up, I'm supposed to keep it elevated at least up to my heart. They don't want it just dangling down. I want to keep it from swelling. I had my cubital tunnel syndrome surgery in my elbow on June 5th of 2008. So it's been right about 1 year and 1 month. And what was going on, I was still having all this numbness in my pinkies as well as in my palm, which that's the symptom of cubital tunnel syndrome. And you know, I let it go just as long as I could. And when I went back to my doctor and around the 1st of July, he had told me, you know, since these fingers, the numbness wasn't coming out, he had told me that my last nerve conductant test, which was done back in November of 2008, he said that you know, test was showing that I was pinched right here in the wrist. The ulnar nerve was pinched here. He said from the elbow to the wrist that, you know, that nerve had healed, which it obviously had because I had gotten all my strength back and everything. I was just having complaints with all this numbness that, you know, wasn't getting any better. And he also showed me on the nerve conductant test, the numbers showed that I had the carpal tunnel in this hand too. So what they did, which you can't take this bandage off, but I got a cut right along my wrist, and that's for the it's called a Guyon canal. That's where the ulnar nerve runs into. So by making a cut in the Guyon canal and freeing up that tendon to take that pressure off of the ulnar nerve, that's supposed to heal up this numbness in the pinky and ring finger and palm within about 2 months. Of course, that's about how long it's going to take all this to heal up. And then for the carpal tunnel, of course, I was cut, you know, somewhere here in my hand. I figure it's about right in here because I'm actually in right much pain. I feel like, you know, I've been cut right here in the palm. It's really tender there, and of course, I feel like I've been cut here in my wrist. And then I, you know, hurt all down through here, which there's not a cut through here, but the doctor said I'd be sore right down because of these tendons, because he did do the Guyon, you know, tunnel area. And anyway, this was kind of, you know, major surgery because there was, you know, 2 releases in my hand. Like I said, one for the carpal tunnel and one in the Guyon canal for the ulnar nerve. So that was 2 nerves that was actually released. So there's 3 nerves in my hand. So I actually had surgery on 2 of the 3 in my hand. I was up all night last night. I was a little bit stressed about the surgery. So I was up all night, and then I was up all day, and I had my surgery about 8:30 this morning. And right after the surgery, you know, I came home and you know, I didn't lay down or anything. Actually, I went out and was visiting different people, and went shopping and to the grocery store, you know, cooked supper, and it's about 11 o'clock at night, and so I'm feeling pretty exhausted, but I wanted to get this video out. But anyway, that's kind of one of the dangers for people that have the cubital tunnel syndrome. I am finding out that it's very common from some of the research I've done, and also from talking to my doctor. It's pretty common that once you have a pinched nerve here in your elbow, because of a repetitive stress, the chances are you're going to get the same pinch here in your wrist because, you know, all that's coming from repetitive stress injury. So, like I said, it's supposed to take about 2 months for this particular surgery to heal. The palm of my hand is supposed to be sore. I think he said for about 2 weeks, and then around the wrist area and down this way, which would involve the Guyon canal. He said that area would be sore about 6 weeks. It would be real sore and tender, but he said I only need, you know, pain pills, you know, 2 or 3 days, which I'm not in any excruciating pain. It's just, you know, I'm very aware, you know, that I've had surgery, and I definitely feel like I've had some cuts. And so they told me the first 24 hours to be sure, like, to walk around like this, like you're pledging allegiance to the flag, to keep this arm up, to prevent swelling and to move my fingers all the time to help with the circulation, which I'm doing that. And I don't really feel like I'm having swelling or anything. Everything feels pretty good other than that. But I just wanted to to do a follow-up, because like I said, this kind of goes along with the cubital tunnel syndrome that I had. This ulnar nerve being pinched in the elbow, like I said, it kind of goes along with being pinched in the wrist. So I just wanted to let everybody know, and also to thank you for all your prayers, because I asked a lot of people to be praying for me, and I did like I said, really well in the surgery. I wasn't like a complete nervous wreck, and I was real calm, and I felt really good about it. And yeah, it is a big relief to know that, because I already feel that the ring finger, I already feel like the numbness is gone from there. I feel like it's just kind of in the pinky right now. One of the things I was kind of disappointed about with my surgery, when I woke up, I had all this extreme numbness in all 5 fingers, and that kind of freaked me out. And the doctor had already gone, and I was asking the nurse that was attending to me, I'm like, all my fingers are numb. And she's like, well, that'll be like that for a couple of days. So, I could have just about cried. Because a couple other people had told me to be sure and ask about nerve irritation, and, am I going to have other symptoms, which obviously I was if I was numb in all 5 fingers. But within 2 hours, I got all the feeling, back in these 3 fingers. Of course, if you're not sure what kind of numbness I'm talking about, it's just like your fingers are asleep and they won't wake up. And like I said, that only lasted a couple of hours, and everything's going pretty good. And like I said, I just wanted to do this update, and for those that are down the road facing carpal tunnel plus the Guyon canal release, just have several questions about that, so I just wanted to let you know, and also thank you for the many prayers that were said for me. And you have a very blessed day.